Hi everyone, I'm Judge Penny Wolfgang in for Phil Arno, who's on assignment. The topic everyone is talking about is the coronavirus. Are we at risk for a pandemic?
We don't have a direct anti-coronavirus treatment. We can manage the patients through symptomatic care and supportive care, of course. Many patients already, the Chinese have said, have survived this infection. The Centers for Disease Control and Prevention have this top of the mind. So there are laboratories around the world, including our own National Institutes of Health, that are now already working on developing a rapid diagnostic test. The other thing they're doing is starting to work on a vaccine. The global community is really watching this with great care, and we in the United States definitely are on the alert and ready to respond.
How is all of this impacting everyone in our hometown? I caught up with Dr. Thomas Russo from the UB School of Medicine to get some answers. We were concerned about our proximity to Canada because there have been in Ontario reported cases already. Do you know what, if anything, is being done to protect us in our side of the border from people coming over, infecting?
Well, there are a number of measures that have been put in place. And when someone crosses a U.S. border, there's screening that's based both on travel history, so have you been coming from a country that has a high prevalence of disease, and then they also focus on symptoms of the individual and their appearance. So as you probably know, the countries that have the highest prevalence disease now are China and Iran, though more recently Italy and South Korea have also been countries of concern. And in fact, if you're a foreign national and you've been in China or Iran in the last 14 days, there's actually a ban from entering this country. Besides using travel-related information to sort of gauge the likelihood that an individual may be infected, they ask about the common symptoms, which is fever, cough, shortness of breath. They also observe the individual, if they, maybe deny those symptoms, but perhaps look unwell, they can make a decision if they want to, sort of assess that individual further. Having said that, it's hard to screen people coming from other countries across borders, and people might also not be completely forthcoming about their travel history or their symptoms. And I do know that there's been a number of individuals that have come into this country in various ports of entry, not necessarily, our Buffalo Canadian border, but certain airports that have been to high-risk countries and never really been questioned about it and not asked about symptoms. And so it is difficult when you have so many people traveling. But nonetheless, these are the guidelines that have been given to these individuals to try to minimize the entry of infected individuals and if there's concern, to appropriately test and quarantine them to minimize the risk of subsequent spread.
A lot of people have been talking about the coronavirus. What does it mean?
Well, the coronaviruses have been with us for many, many years. But most of these viruses, and there's 4 subtypes that were previously known, just really cause the common cold and aren't particularly dangerous. But over the last couple of decades, some cousins of these more benign coronaviruses have emerged, and I think many people now have heard about MERS, which is primarily in the Middle East, and SARS, which was actually in North America, but never quite made it to Buffalo and sort of stopped in Ontario. And the first SARS virus actually died out, if you may, was no longer transmitted between humans. But most recently, a new coronavirus called SARS-2, if you may, has emerged and is now spreading around the globe, and it is a concerning virus.
What makes it different than an ordinary virus?
Well, there's many, many viruses, and they have different magnitudes or ability to cause serious disease. So I think all of us each year get common colds, which are a nuisance. They last for maybe a week or 10 days, where we have a little sore throat, maybe a little bit of a cough and a runny nose, but we don't really feel that sick. A more serious virus per se would be influenza, which every year influenza causes a significant number of deaths in this country, particularly in individuals that have underlying heart or lung disease or immunocompromised or older. The new coronavirus is behaving more like a serious influenza virus.
How worried should we be in Western New York?
Well, I think that cautious concern would be probably an appropriate way to phrase this. So the good news is that we have, at least as of yesterday, no documented cases of the new coronavirus in Western New York. Having said that, I think it's highly likely and almost inevitable that eventually we are going to have some cases here in Western New York. I don't think that we're going to be able to prevent the spread of this virus, but we're hoping to slow down its spread by a number of measures that have been employed.
With our proximity to the Canadian border, what precautions are being taken?
As of yesterday, there was a total of 35 cases in Ontario, which is obviously the province of concern for us. The good news, however, is all of the cases in Ontario have been from people that have traveled to areas where the coronavirus was prevalent or close contacts of those individuals. And so there, at least the present feeling is, and of course testing is in progress, that there's no what we call community spread. So cases that are occurring now independently spreading within the community.
They're working on a vaccine. What treatments are being used on those with the virus?
So part of the reason that this virus is of perhaps greater concern than the influenza virus, at least for those of us in the medical community, is really in part related to the fact that, unlike influenza, we don't have any right now approved medications that have been shown to be beneficial for the new coronavirus or the new SARS virus, unlike flu, where we do have a couple of medications that could be helpful. Likewise, we have a vaccine, though it's not perfect, that could significantly protect us from bad outcomes with influenza. And as I'm sure you've heard, there's lots of talk of developing a vaccine, but that's really going to be well over a year away from coming to fruition.
If someone did get the coronavirus, as an infectious disease expert, what would you tell them to do?
Again, there's some good news about this, and it seems that the majority of individuals that have been infected with this are either asymptomatic or minimally symptomatic and not particularly sick and are able to get better on their own. So what doctors are telling people, if they do have the coronavirus or they have a suspicion that they have the coronavirus, really to stay home, minimize contact with other individuals, self-quarantine at home, and keep a close eye on your symptoms. And if you're feeling that you're getting sicker, of course, you need to come to medical attention. For those individuals that are sicker, of course, they need to come to our emergency rooms. And even though we don't have medications, there's a spectrum of supportive care that we could help these individuals get through the illness.
We mostly hear about how to prevent getting the virus, such as washing your hands. What about wearing gloves, especially for people in the retail industries? Would that help?
Yeah, using gloves really isn't recommended because, so maybe just take a step back about how the virus is transmitted. And there's at least two modes and potentially a third mode of transmission. So the first is airborne. When someone is ill, if they cough or sneeze, there's particles that we think only travel perhaps 6 feet, though that hasn't been established. It's possible it could be more than 6 feet. And if you breathe in those particles, that's one means of getting infected. The other means is if those particles that contain the virus land on an inanimate surface, you subsequently touch that surface because it could remain viable for, we think, hours based on our knowledge of similar viruses, and then touch your eyes, nose, and mouth. That's another means you could get infected. So it's this latter mechanism of transmission that people have been emphasizing, washing hands and not touching your face. If you wore gloves and you touched a surface that was infected, you would then just get the virus on the gloves, which are not as easy to wash or disinfect as your hands actually. And so that really there's no benefit from the gloves than from your hands and just using good hand hygiene. Elbow bumps. We love elbow bumps, right? You know, no fist pumps, elbow bumps. But I think the most important thing would be for one, if you're feeling ill, and now in this part of the world, if you're feeling sick with a respiratory virus, the overwhelming odds are you probably have influenza or something else. You probably don't have the new SARS virus because the prevalence is very low. But you should stay home and you shouldn't interact with your colleagues and friends and family. And even if, of course, if you're in a house with other individuals, it's best that you sort of use your own bathroom, try to minimize contact with those individuals. And again, good sort of respiratory hygiene, good hand hygiene as well.
There's been so much said and written about how to prevent it, who has it, what causes it, and so forth. And I think a lot of people are getting information from the internet, from Facebook, from Google, from really unauthorized sources, and they're getting misinformation. And I think the worry has been exaggerated to the nth degree because of a lot of this. Is there anything we can do about it?
Sure, and that's really a great question. Social media is both a strength and a weakness in terms of it allows us to disseminate information very rapidly, but it doesn't have check and balances, and as you pointed out, could be lots of misinformation. We have really two great sources. The first is the Centers for Disease Control, and their website is cdc.gov, and they've got a tremendous amount of information both for healthcare professionals and lay individuals alike to inform you about the number of cases, ways to protect yourself, a little bit about the virus, really anything you need to know. Travel-related questions if you're going somewhere or coming from somewhere. Our New York State Public Health Department is also a very good source of information as well. They are consistent, however, with CDC recommendations. And so those two venues would really be the best site for accurate information. And we heard absurd things that hopefully no one will believe, gargling with bleach, for example. Extraordinarily dangerous for your health and in no means is going to prevent infection. So beware of what you may read on social media.
Beware of fake media and fake information and misinformation, for sure.
Absolutely. Yeah. Though sometimes discerning what's true and fake is difficult for the non-healthcare professional. Therefore, the CDC website is your best bet.
We encourage everyone to do the right thing, to take precautions. Don't panic, and work together as a community so we can stay safe and stay healthy. When we come back, find out how Habitat for Humanity is making a difference.